Remember, there's trouble in River City, and that starts with T, and that rhymes with P, and that stands for plaque. And that's the E in the word trouble, exploding plaque. This opponent will kill more of us this year than any other opponent. So it's important that as we face the Plattsburgh Pirates, we really understand and know how to overcome this terribly difficult and dangerous foe. So let's go to our scouting report and learn as much as we can about the Plattsburgh Pirates. The Plattsburgh Pirates are a devious bunch. They'll try to assure you that if your parents didn't have a heart attack or stroke, don't worry about it. They'll try to avoid detection in every way they can until it's too late. The majority of the time, they have recruited you into their clutches and pounce on you before you know you even had a problem. Striking when you least expect it, they must be recognized early and acted upon quickly to prevent their quick victory. They can be anticipated because they follow a particular group of suspects. Whenever you see the couch potatoes, the hamburger helpers, or the Colorado Carbos in your life, you know they're trying to set you up for the Plattsburgh Pirates. Often, the Plattsburgh Pirates pick families to attack, but even in families with no history of ever visiting the Plattsburgh Pirates before, they are still the most common foe. So one can never be too wary about this opponent. We're very lucky today to have a true expert on cardiovascular disease and its prevention with us today. Dr. Renee Courtney will be our coach for today's lesson, so let's learn more about Renee's background. Renee Courtney is a unique combination of practical and academic knowledge. She graduated from college with a bachelor's, got her master's and her PhD in nursing from Texas Women's University. Her major during her master's degree was as a cardiovascular clinical specialist, and with her PhD she did her dissertation on recovering from a myocardial infarction or heart attack. Since that time she's taught at University of Texas in Arlington, where she is an author, speaker, and researcher. But very interestingly, she spends 30 to 50% of each week practicing medicine and working with people, learning how to take better care of their health and live longer and better lives. So let's get straight in the game and join Dr. Courtney as she teaches us about the Plattsburgh Pirates.
Hello and welcome to this session of Game of Health. Today we're talking about the Plattsburgh Pirates. That's the team that I'd like to help you win. I wanted to show you what plaque looks like in a coronary artery, although this little model shows the plaque, the slime, the sludge build up inside of the artery. In reality, it's in the vessel wall. But the idea is very clear here that as the plaque progresses and takes up more and more space, it's less likely for blood to be able to get through. And when that plaque ruptures and a blood clot forms, that's what totally obstructs an artery and causes a heart attack or causes a brain attack. I'd actually like to help you whack your plaque and learn how to do that, whether that's to get rid of it, whether that's to prevent it, whether that's to control it. The Plattsburgh Pirates are a tough team and they're really out to get you. So let's talk about how to be motivated to do something about your plaque. I've got good news, I've got bad news. I'd like to start with the bad news so that we can be done with that. There are three things I'd like you to know in terms of heart disease and plaque. Number one, there's a killer on the loose in this country, and that killer is coronary artery disease. It is the #1 killer of both men and women in this country. Number two, heart attacks are deadly, particularly first heart attacks. Most people who are going to die die during the first heart attack, which means you don't get that second chance to make a difference in your life, to back up, to change it, to live differently, to prevent heart disease. And number three, over 50% of men and over 60% of women, the first evidence they have about heart disease is their heart attack. They have no signs, they have no symptoms, they have no idea until they experience their first heart attack. That's the bad news, and I hope that that will motivate you to really try and get off of that bench, out of that dugout, up to the plate to begin to whack your plaque. Let's talk about the good news, but before I do, I want to tell you about a patient. Mr. Brown is his hypothetical name. I'll protect his identity. I saw Mr. Brown about 6 months ago in the clinic, and he was in for a sinus infection, and I noticed that he was overweight. I noticed that his blood pressure was high. He told me that he had a history of high cholesterol, and I was very concerned about him and told him I'd help him with his sinus infection, but I'd like him to have some lab work done and come back so we could begin to look at his risk for heart attack, for heart disease, for stroke, and to make a difference in that risk. So he came back, we looked at his numbers again, and sure enough his cholesterol was even higher than he had recalled it being. And we talked about what he might do to make a change in his life. He told me that he wasn't willing to do anything at that particular moment, that life was busy, lots going on with his family, a tremendous responsibility at work. He said, I'll wait until things calm down in my life, and then I'll start a new medication. I'd be willing to do some exercise to make some changes in my life. And although I strongly encouraged him not to delay, that was his decision. It was almost his final decision. A couple of months after that, he had a massive heart attack. He ended up having damage to over 50%. That's half of his heart muscle, and that can't be repaired when that happens. He eventually came back into the clinic and he said to me, now I'm ready to make some of those changes that we talked about. And I was glad he was back, but his life will never be the same because he chose to wait. So hopefully in today's session, you'll learn some powerful steps that will help get you around those bases to whack your plaque and to win against the Plattsburgh Pirates. One of the important things for you to know about in your battle against plaque has to do with risk factors. Knowing what your risk factors are, and more importantly, knowing what to do about those risk factors and what you can do to control those, to avoid them, or at the very least to reduce those. You may have heard your health provider talk about risk factor. Let's be sure that you understand what I mean when I say that. A risk factor is a personal characteristic. It's something about you and your health, something about your past health, something about your family's health that predicts what your risk of heart attack in this case might be. And I'd like to talk about some of those risk factors and have you be thinking with me as we go through that list where you are in terms of your individual personal risk factors. The first two risk factors really go together, and unfortunately you can't do anything to alter those except to be aware. If you are a male and you are 45 years of age and older, you are in that category that places you at a higher risk. And of course, as you age, your risk for cardiovascular disease increases. If you are a female, your risk for cardiovascular disease increases when you turn 65. So that's age and gender, two very important risk factors. Family history is an important risk factor. Your blood relatives and whether or not anyone in your family has had heart attack or stroke. We listen very carefully as health providers to learn whether those family members, and by that I mean blood relative, your father, your mother, your grandparents, aunts, or uncles, if any of them have had what we consider to be premature heart disease. And that means any male who is a relative who has had a heart attack or died before the age of 55, and for females, anyone who's had a heart attack or who has died before the age of 65. We consider that to be premature heart disease, and it raises lots of red flags. Now, you can't go back and change that either, and your family's history is not necessarily your destiny, but it's very important for you to know and understand what those risk factors are and how they might predict the likelihood of your having a heart attack. There are several other risk factors too, and I know you've heard about those already in the game of health, and those are the trouble numbers, T-R-O-U-B-L-E, and let's just go through those quickly together. Hopefully this will be a good review for you. T is for training, and if you are sedentary, meaning you're not up and active and getting at least 30 minutes of accumulated exercise most days of the week, that's a significant risk factor for you. R is for roundness, and that has to do with your weight, your body mass index, and where you might carry that weight, whether you have any central kind of apple-shaped action going on, having abdominal obesity. O is for oil, and that's the cholesterol numbers, and I want to take just a moment and review those with you to be absolutely sure you understand how those numbers look for you. And if you don't have your personal numbers for your cholesterol panel, very important that we help you get those numbers together. Total cholesterol is the overall cholesterol with everything added together, and it includes your LDL or your lousy cholesterol and your HDL or your healthy cholesterol. Lousy cholesterol is that cholesterol that builds up in the walls of your arteries, like the Plaque model that we looked at. And that's what can lead to rupture and ultimately to heart attack, or if it happens in your brain, to stroke. That LDL number ideally would be 100 or less. Now, your provider may give you a different goal based on the number of risk factors you have, but typically the ideal LDL is a range of 100. HDL, or the healthy cholesterol, we like for that number in general to be greater than 40. The more you have of the HDL, the better. The higher the healthy is. You can remember it that way. For men in particular, we want it to be more than 40. For women, we like that number to be greater than 50 if at all possible. And then lastly, the other part of the oil panel, so to speak, is triglycerides. And that's the number that should be lower than 150. And that's what you're working to achieve in your lipid panel through your lifestyle, through what you're learning about exercise, through your healthy nutrition. And then in a little while we're going to talk about some things, some very powerful allies that will help you even more to reduce those risk factors. But let's finish the list. We've done training, roundness, oil, and now for you, which is unacceptable sugar. And that has to do with if you are a diabetic or if you are pre-diabetic with insulin resistance, you're at a much higher risk of heart disease, a very important risk factor for you. B is for blood pressure, and that's a very important risk factor that can be fairly easily controlled if your blood pressure is too high. Your goal for blood pressure, optimal blood pressure, is actually 120/80 or less. We would never want you to be higher than 140/90, and some of you may have other personal health factors that will dictate what your blood pressure goal needs to be. For example, if you have diabetes, the goal for your blood pressure will be no higher than 135 on the top number, or systolic, and no higher than 80 on the bottom number, or the diastolic. And then lighting up, which is the L, standing for smoking. You know, I have so many patients who will tell me they're concerned about a spouse who smokes or a loved one who smokes because they're worried about lung cancer, they're worried about emphysema. In reality, you're going to die a long time before you might die of lung cancer from heart attack or stroke if you smoke. It is a very significant risk factor for cardiovascular disease. And then lastly, E standing for exploding plaque. And that's where you put all of the risk factors together to see what your overall risk factor score is and how those provide a profile for you. If you look in your packet for just a minute, there is a sheet of paper that will help you calculate your Framingham risk score. That's an overall score that helps you understand and helps your health provider understand what your risk of heart attack is going to be over the next 10 years. And basically, that doesn't use all of the risk factors that we've talked about tonight, but it uses the specific risk factors that through 50 years of research in a little town in Massachusetts called Framingham, that helps us to understand how to calculate your overall risk. If you have a risk of less than 10, that's low risk, that's good. If your risk of heart attack over the next 10 years is between 10 and 20, that is a moderate risk, and you need to be very active in reducing your risk factors. And if your risk is 20 or above, 20% chance or above, then we are very concerned about you. If you have diabetes already, if you've been diagnosed with that, if you've already had a prior heart attack, if you have problems with your peripheral circulation, peripheral arterial disease, if you've had a stroke, those are all factors that will put you above the 20% mark. So I'm going to let you pause the tape right now, and your facilitator can help you work through to calculate your very own Framingham risk so you know exactly where you stand on that. You've now calculated your Framingham risk, and I just want to let you know, if your risk level is high, let that get your attention. That's important. That will help motivate you. But I also want you to know that no matter how high your risk level, there are always very important things that you can do through your lifestyle, as we talk about in the Game of Health, and that we can do as health providers to help you lower that risk and control that risk. Very important message for you. There are always things we can do to control that risk. In addition to all the risk factors that we had talked about, there are some new risk factors that we're learning more about over time, and I wanted to mention just 2 or 3 of those because you may be hearing about these in your doctor's office or as you're reading or watching television. One is called cardio-CRP, and it is a special indicator of how much inflammation there is in the lining of blood vessels. The higher the cardio-CRP, the higher the risk of heart disease. A second new risk factor is homocysteine, and there's actually a lot in the media about homocysteine. It's an amino acid. It's a part of what your body metabolizes, but again, the higher the homocysteine level, the higher the risk of heart disease. And then the third new risk factor, emerging risk factor, is called Lp(a), a fancy term. It's a special kind of cholesterol, and again, the higher that is, the higher the risk of heart disease. So those are all measures that you may know what your numbers are, or you may want to ask your provider to help you figure those out. And finally, when one is thinking about identifying risk for heart disease and where you are in terms of your personal characteristics, there is something called an electron beam tomography. That's a mouthful, I know. The EBT, or you may see it abbreviated as EBCT, and basically what it is, it's a super fast CT scan or CAT scan. Some of you may have had CAT scans for various kinds of health problems, but this is a very special super fast one, and from the outside they are able to actually visualize your coronary arteries as your heart is beating, and you can sit down after you've had that scan done. It takes about 5 minutes, and actually look on that screen, and you can see how much plaque, how much calcium you have in your coronary arteries, and that will give you a very good idea of how active you need to be in terms of reducing your risk factors and controlling your plaque. So that gives you an overview, I think, of how you assess your personal risk factors, and now you're ready to move on, and you're rounding second base. So you're almost there. You're getting there. I know you're already doing things in terms of lifestyle regarding exercise, regarding healthy eating, regarding sleep, rest, those kinds of things, but I want to tell you about some very powerful allies. I mentioned earlier that we would talk about these. You need to be aware of how these 5 new allies can be very helpful for you in controlling your risk. The first one is a category of drugs we call the statins, and I really believe the statins are miracle drugs. And if you look at the research that's been done literally around the world, hundreds of thousands of people have been on the statin drugs. You may know them by some of their trade names, such as Pravachol, Zocor, Lipitor, Mevacor, and there are a few others. Those drugs do three things for you, very important in controlling your plaque. Number one, they help to significantly lower your LDL, and recall that LDL is the lousy cholesterol, the number that you want to get down for many of you to 100 or lower. And the second important thing they do is to harden the plaque. For those of you who have plaque, remember our worry is that that plaque ruptures into the blood vessel and causes a blood clot leading to heart attack or to stroke. The statin drugs actually harden that plaque, so it's much less likely to do that. And then thirdly, the statin drugs reduce inflammation in the blood vessels. Inflammation in the blood vessels makes them much more sticky and much more likely to grab cholesterol flowing by in the bloodstream. So anything we can do to reduce that inflammation serves you well in terms of controlling your plaque. With the ACE drugs, these are very important drugs to help lower your blood pressure, but even more importantly, they will improve or protect kidney disease if your provider thinks that that is indicated. They also will reduce the onset or the incidence of diabetes if you are prone to that. They will actually help protect you from diabetes, and they also reduce the incidence of heart attack. So the ACE drugs are another very powerful ally for you if those are indicated. The third ally is aspirin. Yes, good old aspirin. It's been around forever. We have learned that what we call baby dose of aspirin, which is 81 milligrams, the normal aspirin that adults take for headache and those kinds of things is 325 milligrams. But we've learned that a dose of 81 milligrams of aspirin actually makes the platelets less likely to stick to each other, less likely therefore to form a blood clot as in heart attack or in stroke. So talk to your health provider and see if aspirin is indicated for you. We know that it can reduce the risk of heart attacks and strokes oftentimes by up to and over 30%, a very powerful drug for you. Fourth on the list of new allies is fish oil. These are what you may have heard of as the omega-3 fatty acids, and what the fish oils do is to, actually they do a couple of different things. At low doses of 1 gram a day, they will actually stabilize the electrical system in the heart. A lot of people who die of sudden death, that happens from an electrical instability in the heart, and so a gram a day of fish oil can help prevent that. At doses of 3 to 6 grams a day, if you're using a fish oil supplement, they can actually help to lower your triglycerides. For those of you who want to get your fish oils or your omega-3 fatty acids in natural sources, eating fish, serving of fish 2 to 3 times a week, and the particular kind of fish is tuna, like a tuna steak, or salmon or mackerel. Those fatty fishes, the cold-pressed fishes, contain the omega-3 fatty acids. No, not fish sticks, not some of those, but the kinds of fish that we've talked about. The salmon, the mackerel, and the tuna are very helpful for you. And then the fifth ally that's important are what we call the monounsaturated fatty acids, and these are very powerful. They are found primarily in substances such as olive oil, canola oil, and even in flaxseed oil. But probably for most people, olive oil is the most important way to get a monounsaturated fatty acid into the diet. There was a study done in France, Lyon, France, and they worked with people who'd had heart attacks, and they increased their intake of monounsaturated fats. And what they discovered is that the risk of a second heart attack for these people who were very high risk because they'd already had their first event was reduced by almost 70%. That's a much stronger reduction than even with the statins and some of the other things that I mentioned to you. So finding ways to increase monounsaturated fat in your diet is important. So now you've rounded second, you have the benefit of your lifestyle changes, you have the benefit of these allies that are important for you if indicated. You're coming up to third, rounding third. Very important to keep you on the way that you monitor your progress and how you're doing. You should have lipid levels, and by that I mean your cholesterol panel, depending on your health status, depending on your risk factors. You should have that monitored for many of you every 3 months. Your health provider will help you decide the frequency of that. But you need to not only have it monitored, you need to know what your personal goals are that you're driving toward. Otherwise, any number will do. And remember, the LDL goal for most of you will be 100 or lower. Some of you it may be 130. The HDL goal will definitely be above, do you remember? Will be above 40, that's right. And the triglyceride goal will be less than 150, and then the total cholesterol goal will be less than 200. And of course, monitor your weight, monitor your blood sugar. All of those numbers, monitoring, driving toward goal is what helps you round third base on your way home. Rounding third base, I want to be sure that we talk for just a few minutes about what a heart attack is, and if you should experience a heart attack or a loved one or a friend should. We want you to be prepared. All of your work is about preventing that from happening, but we know that heart attacks, in fact, do happen. I want you to think about having a heart attack not just as an event, but as a process that happens over time. Because if you think of a heart attack in that way, you'll understand why it is so important to recognize a heart attack as early as you can so that you can take quick action to protect the heart muscle and indeed to protect your life. Because it is a process. The earlier you're able to take action, the more effectively we're able to protect your life literally. So 2 rules for you to think about. Rule number 1 is getting to the hospital as quickly as you can. Because having a heart attack is a process, you have at best 1 to 2 hours to really be in the emergency room, be at the hospital, so that it can be diagnosed and steps can be taken to prevent the death of the heart muscle or part of the heart muscle. Because that, by definition, is what a heart attack is, when you literally kill part of your heart muscle. Remember Mr. Brown I was telling you about earlier, that's what happened to him. He actually had death of a pretty significant percentage of his heart muscle. So getting there early, recognizing the symptoms early. And that is rule number 2. How do you know when you're having a heart attack? What do you look for? Well, it's pretty easy if someone has a Hollywood heart attack where they clutch their chest, fall to the floor, tell you that it feels as though they have an elephant pressing on their chest. The pain is so great. That's a no-brainer. You call 911 and nobody quibbles about that. The real challenge is when you have more subtle symptoms of a heart attack, which probably happens more so than the major Hollywood heart attack. And those subtle symptoms can look different in every single person. So let me tell you what a few of those are. You might have a mild pain or a pressure that comes and goes over the period of a couple of hours. Some people experience only a shortness of breath, a pretty significant shortness of breath, particularly older adults. You may experience a very sudden, profound fatigue, not just a little tired, but just totally fatigued that hits you out of the blue. You may have sweating. You may even have nausea or vomiting. And it's difficult sometimes, and you will ask yourself, you know, is this indigestion? Is this the sudden onset of the flu? What's going on here? Or a friend or a loved one may be asking you the same thing. Nobody wants to go to the emergency room and find out they weren't really having a heart attack because they would be embarrassed. Well, let me talk to you about that. If you go to the hospital and you're wrong, let me tell you what will happen. You're going to have the most thorough workup you've probably ever had in your life in terms of what's going on with your cardiovascular system. And even if you haven't had a heart attack, you're going to know so much more about your health status, your risk factors, and what's going on. You will be much more empowered in the future to be able to protect your health and reduce your risk of heart attack. And then if you indeed are having a heart attack, you're exactly where you need to be, and you may have saved your life or the life of a loved one. So either way, you win, and I would encourage you to be careful and to think about that. Good for you. You're rounding home now, and I don't want to leave you on a gloomy note. We've talked about some very serious, very significant things tonight. I want you to also think about the 7 healers and let those help you live your life to the fullest, because that's what life is about. Not just knowing and controlling your risk factors, but really living your life to the fullest. And on that note, we wish you the best in reducing risk factors and want you to know that it's never too late to stop, to make a change. Even a small step in your life can make a huge difference in terms of life and longevity.
How do you know if you need to be in the game against the Plattsburgh Pirates? Well, if you suffer from any of the problems spelled out in trouble, you need to get in the game. These include lack of exercise, obesity, high cholesterol, diabetes or hypertension, or just lousy habits. It's particularly vital that you do it at a young age if you've got any family history of heart attack or stroke. Now, how do we get to first base? Well, we learn about trouble. We learn about each of the components and how to measure it and overcome it. In addition, it's important to know what it would feel like to have a stroke or a heart attack. Once we understand these things, we're ready to head for second base. And getting to second base means looking at our habits. What do we do to currently cause our problems with trouble? Whether it's eating the wrong fats, maybe getting lost, if you will, with the hamburger helpers, or the Colorado carbos, or the sleepless sloths, or the portly trailblazers, well, all of those things, of course, lead to a visit from the Plattsburgh Pirates. Once we've figured out the habits that cause these problems, it's time to head for third base, which is practice, practice, practice. Learn those new habits. If you'll do them for 21 days, you'll have them be incorporated as a part of your life, and you'll give up those old habits that led you to get in trouble. Find people who want to do it with you. Find people who really will encourage you to do it, and make yourself accountable to them. Support groups like the Game of Health can be a key to fighting off the Plattsburgh Pirates. Once you've done this and your 6 numbers are back under control, you are a success, completely and totally. Not only have you done the individual steps that led to your success, but now you get the success of getting out of trouble. And it's time to head home. How do we get home? Well, we laugh all the way, because anybody we know, anybody we care about that has any of their numbers out of control, or anybody that needs to learn about trouble, it's time to tell them to get in the game. Thank you for playing the Plattsburgh Pirates with us today. And thank you, Renee Courtney, for that excellent game plan and coaching. Now remember, the secret of life is enjoying the passage of time and making sure that you have the time to enjoy your life in. So get your 6 numbers, get them under control, and if you do that, you know you're in the game. Thank you for joining us this week, and we'll look forward to meeting with you again next time.